there is a high degree of overlap between existing eating disorders and this kind of ultra processed food addiction, if we're focusing specifically on ultra processed foods. In addition, I think that there are, significant clinical differences in the presentations that have already been conceptualized relative to what we're proposing and thinking about and chatting about today for ultra processed food addiction. For instance, binge eating disorder, which is the highest degree of overlap, it's very specific to these 2-hour overeating windows, and it actually doesn't specify that any type of food that needs to be implicated, just that it's an objectively large quantity of these foods. And then from an addiction standpoint, you can have binge consumption, but you can also have grazing. Some of the most significant addiction presentations, they're starting first thing in the morning and they're just kind of grazing on the addictive substance all day to just keep that dopamine, high. So I think that both of those things are true with respect to this overlap. I absolutely agree with what Nicole mentioned, though, about exposure to this, different treatment perspective and trying to understand, other approaches besides moderation would be especially important.